Why does global health matter? Well, you've already seen just in that brief video a couple of reasons why. We might start by just observing that disease knows no borders. Gro Harlem Brundtland, who was the former Director General of the World Health Organization, once observed that in an interconnected and interdependent world, bacteria and viruses travel almost as fast as email messages and money flows. So we've seen evidence of this with H1N1 and avian influenza, tuberculosis, any number of conditions that spread from country to country, and given the travel and communications that we have now, that's pretty obvious that disease knows no borders.
But storytelling, and I think it's a good follow-on to what Jeff talked about, is a really powerful tool as we think about how we can advocate, how we can affect change, and really make an impact in global health. For the last number of years, Bill and Melinda have been traveling the world, exploring global health issues and really digging deep to understand these issues. And as they traveled, they saw something that in some ways surprised them. They saw a lot of progress, and it's progress that Jeff alluded to as well. But when they came home and they picked up a newspaper, they watched the television, they didn't see those same stories being told. In fact, they saw the opposite. They saw the negative stories about global health and global investments being told. They knew that they were certainly making an investment and a contribution within global health, and certainly the US government was making a significant investment, significantly more than them. But again, they weren't seeing those kinds of stories told. So they wanted to go a little bit deeper.
Advancements in maternal health care are inextricably connected to the varying inequalities women are subject to globally. These considerations are built into the strategies that WRA employs to promote the vital contribution mothers make to families and to communities. Child survival rates drastically decline by 50% if a mother dies. Children who survive their mother's deaths are less likely to attend school, reach their potential, and often are victims of discrimination, malnutrition, and exploitation. If a relational network is not in place, the newborn is then orphaned and the limited community resources strained. An investment in maternal health is an investment in healthy communities.
I think that this actually is an area where philanthropy has a really important role to play, because often, and I realize that a lot of the comments I'm making are extremely general, so please, when you have a chance to intervene, press us for some of the details. But what happens often is the public sector, which, again, to go back to what Louise Arbour was saying yesterday, we tend to think that certain things are the responsibilities of states. So healthcare, for many years, people thought was the responsibility of states. And if that were true, then there wouldn't be all of the challenges that we face in global health, because all of this would have been taken care of. But in fact, it hasn't, and states are having difficulty in both obtaining the relevant and adequate resources and figuring out where to allocate them. So what I think has been really exciting over the last 10 or 20 years in global health are the number of innovations that have just bubbled up from the ground by community organizations trying something new, by things like kangaroo mother care. These are terrific innovations that are making a real difference in the communities and in the areas where they've been tried. And often those have been the result of people like yourselves hearing about somebody who has a good idea and giving them enough seed capital to actually get it started.
I'll take it also in a different direction a little bit. I had the complete honor of spending last week in India, and went to some pretty interesting and remote places. One in particular in Bihar, one of the northern states and actually the poorest state in India, and had a chance to go to a village where they are delivering polio vaccines, and where there is still one of the few places in the world where there are polio challenges. And I think that's an area where we know the number of cases that exist in the world, and we know the number of countries where it exists. And seeing that firsthand, seeing the delivery included a gentleman on his bicycle with 2 coolers on the back tire delivering the vaccine over 2 bridges that in a month, when the wet season comes, will be completely locked in by water.